yeah, just want to welcome Kirsty again for joining us. Last month, it was recommended that we get an exercise physiologist, and straight away I thought about Kirsty, and so I got in contact with her, and she was, yeah, you know, thankfully she was happy to put her hand up because, you know, movement and exercise is really important, and, you know, she wants to get the word out there as well. Kirsty actually used to work at the Royal Talbot, so some of you guys probably know her from here at the Royal Talbot, but if you don't, she's fantastic. So I'll just hand it over to Kirsty, and she can tell you a little bit about her background and where EP fits in with everything that's important to us.
Awesome. Thank you, Naz. And thanks everyone for showing interest. I'm always happy to talk to everyone about why they should exercise. So as Naz said, I did used to work at Talbot, and now I work at STEPS Neurological Therapy Services. So I've worked with spinal cord injury since 2009, and have had the pleasure of working with people across sort of the lifespan of spinal cord injury, really. I've been able to work with people in that early rehab space at the hospital, but now my job is working in the community. I get to see people right across the lifespan and starting to work with all the different health conditions and injuries that might come up as you age with a spinal cord injury as well, and understanding how exercise plays a role in all of that. So I'm just going to pop my PowerPoint up for everyone to see. Hopefully this will work. I'm not the best with IT, so here we go. Start at the start might be a good spot.
Are you doing fine, Kirsty?
How are we going? Can we see that, everybody?
Yes.
Yep. Excellent. So I guess when Naz asked me to talk today, I guess there's a lot of different directions you can take exercise and spinal cord injury. So I've gone with a very general overview of how it fits with general health and wellbeing, and what the sort of government recommendations are, and sort of what that is, why we should do it, and how we can get started, and how we can translate those recommendations to different injury levels and things like that to make sure that everyone's given the opportunity to exercise. I quite like that little cartoon that's gone viral really on lots of health professionals. Is exercise is the one intervention for people across all ages, all conditions, all injury levels that has the most evidence for all health factors. So whether that be, you know, cardiovascular health, your general health and fitness, cancer prevention, metabolic health. So there's lots of different reasons why you should exercise, but for some reason, and we've got very good evidence of why we should exercise, but getting the adherence to exercise is our hardest hurdle. So we're going to go through the basics of what, why, and how to exercise. Naz did ask me to talk briefly about what is an exercise physiologist. I've been answering that question pretty much my whole career. So it is not as common as some of the other allied health professionals, but an exercise physiologist is a university qualified allied health professional that has completed a minimum of 4 years university. We've got specialised knowledge to design, deliver and evaluate safe and effective exercise interventions for people with acute, subacute or chronic medical conditions, injuries or disabilities. So exercise really is our game. Exercise and lifestyle intervention, education, and trying to get people to be able to independently manage their health and well-being. We do work in collaboration with other allied health professionals. So you might find us working alongside your physio or your occupational therapist, or you might work with individually just directly with an exercise physiologist. You'll find us working in hospitals, in private practices, in gym settings, or anywhere out in the community. So, in my day-to-day role as an exercise physiologist, it varies depending on the client who turns up and what their goals are, but we can focus on anything going from rehabilitation to injury management and prevention, strength and conditioning programming, cardiovascular training, lifestyle education, weight management, community integration, which might mean accessing your local community or setting you up in your local gym or sports clubs, return to sport and recreational exercise, hydrotherapy, return to swimming and water safety training, and then manual wheelchair skills training as well. So we do have a fairly broad and diverse job, which keeps it very interesting for me. There's definitely not one client that's the same as another.
Come to the radio, please.
Now, I guess, why do we exercise? And it's a little bit different for everyone. So I guess, for everyone to have a bit of a think, why do you exercise and why do you want to? Or is there a reason in your mind that you think you should exercise? Because I guess that's the starting point for each person. We know that there's lots of great health benefits that we do see from exercise, and they're very well documented. So everything from improving brain function and memory, weight loss, preventing illness such as cardiovascular disease, helping to quit smoking, improving mental health, improving strength, longer life, reducing the risk and severity of falls, preventing cancers, and risking heart and lung disease. There's also very well, and I think at the moment this is a really important space with COVID and the decreased interaction everyone's been able to have with their friends, family, with their normal health and support team. I think the mental health is a huge thing. And as you can see by this slide, there's a lot of evidence out there about the ways that exercise can help with your mental health.
Kirsty, can I just quickly interrupt? Is there any chance of increasing that screen? Because this looks like this looks like a really good graphic. And
let me see. I've got it on full screen here. So
okay, because on my screen I can see the next slide as well. I'm not sure if the others can see that as well.
Plus, maybe on your screen.
Yeah, that's the biggest I seem to be able to get it
up. Is it? Okay, sorry. Mine, I can just see the next slide as well on the side of the screen. Anyway, yeah, just wanted to...
I think that might just be us controllers that have that.
Yeah, okay.
Yeah.
If anyone's got any questions along the way, are you happy to take questions? Or
just jump in. I'll talk all day if you don't.
So everyone just ask a question if you've got a question or take a note. And
I'm more than happy to share the slides with you too, Naz, if you'd like them at the end.
That'll be great.
Yeah.
Thank you. Have a question. That's right, Naz.
Did someone have a question?
Yeah. I was just wondering, you said it can reduce the severity of falls. How does that play? Is that just from...
So in terms of the injury risk.
Okay, yeah.
Yeah, so if you so in terms of if you've got better bone density, better muscle mass, things like that, then the injuries sustained in falls generally aren't as serious. Yeah.
Yeah, that's what I was thinking. Thank you.
So I guess now to look at exactly spinal cord injury specific. So they're the general health and benefits that are well documented. But in terms of what we see in spinal cord injury, what people often experience after their injury is a decreased exercise capacity. And we see that from very early on, from the rapid deconditioning that happens after an injury. Depending on the level of injury, we see altered heart function due to the damage to the spinal cord injury and nerves, increased or changed workload on certain muscle groups. So if anyone who's a manual wheelchair user, I'm sure understand the increased workload that their shoulders and their arms have to very suddenly undertake after getting a spinal cord injury. Increase in sedentary time. So that's the time that you spend not moving. So after a spinal cord injury, that's markedly increased, and especially for anyone who might be a power wheelchair user. Increased risk of weight gain, increased risk of cardiovascular and other cardiometabolic diseases such as type 2 diabetes, and an increased risk of respiratory illness. I guess the other thing that's worth mentioning is not only are persons with spinal cord injury at an increased risk of respiratory illness, the impact that they have on them is significantly greater. So while someone else who gets an upper respiratory infection might end up just slightly unwell, someone with a high-level spinal cord injury might end up in hospital. So the risk factors are really quite severe for those living with spinal cord injury.
So with that risk of not moving around and all that, what are some of the derivatives from that? Is that, I guess, plays into, again, the bone density and...
Yeah, so we'll get into the specifics in a little bit further down the line. But yeah, with that sedentary time, it's the decreased movement that you have. You atrophy muscle, so you lose muscle quicker, you lose bone density quicker. Your heart and your lungs are essentially sort of muscles that we train. So the less that they're moved and the less that they're used, they also decondition and become less effective, which in turn increases all those other secondary health factors. Does that make sense?
Yeah, definitely. That's interesting.
Yeah. Kirsty, sorry, you mentioned atrophy, muscle atrophy. Now, is that where the muscle, because it's not being used, it turns into, I don't know, this is my word, into like jelly?
Yeah, so we lose that muscle bulk.
Okay, and can you, if you work on that, can you like bring that back to how it's supposed to be?
If you've got active muscle, if you have voluntary control of the muscle, then yes, you can rebuild the muscle that you've lost. So if you have been particularly lazy over the last 6 months and not been doing any strength training, then if you return to doing strength training, we'll see what we call hypertrophy, which is the reverse of atrophy, and that's gaining muscle mass back again. But we'll only see that in muscles that we have voluntary control over. Does
the spasm also help to a degree, like even though it's involuntary?
Yes, spasm can maintain muscle mass. That's almost a completely separate discussion in terms of spasm management. For some people, they do find spasm can be positive and they can use it to their benefit. For others, it's very, it can actually get in the way of function transfers and sleep, and we're actually trying to dampen down that spasm. So, yeah, spasm management's definitely a sort of a bigger conversation.
Yep.
Yeah. So back to spinal cord injury specific benefits that we've seen. So we have seen in spinal cord injury that exercise can have positive effects on muscular strength and flexibility, that it can have decreased the risk of shoulder pain and overuse injuries, decreased risk of depression, improved documented quality of life, improved functional independence, increased cardiorespiratory health and fitness, improved respiratory function, decreased incidence of upper respiratory infections, improved immune function, which I think, again, with everyone having a little bit of a fear this year over the coronavirus and that, anything that's going to improve the function of our immune system is welcome, and decreased risk of cardiometabolic disease. So I've just popped this one in, and this I would like everyone, if you've got a second to work through, this is what we call the exercise self-efficacy scale. And it's to get a bit of an idea, and no one has to announce their scores, but we can do this privately, of how confident you feel right now that you can exercise and that you know what to do. So for each rating, each number there, 1 is the lowest, you don't feel that that's true. That statement's true to you, and 4 is yes, that's definitely true for me. And the highest score would be 40, and the lowest score would be 10. So how confident do you feel that you can overcome barriers and challenges with regard to physical activity if you try hard enough? Do you find that you can find means and ways to be physically active? Do you find that you can accomplish physical activity and exercise goals that you set yourself? When you're confronted with a barrier to physical activity, can you find solutions to overcome this barrier? Can you still be physically active or exercise even when you're tired?
No.
Can you be physically active or exercise even when you're feeling depressed?
You talking about yourself or me?
Can you be physically active or exercise even without the support of your family and friends? Can you be physically active or exercise without the help of a therapist or trainer? Can you motivate yourself to start being physically active or exercise again when you've stopped for a while? Well done, Naz. You've already overcome that one. And can you be physically active or exercise even if you have no access to a gym, exercise, training, or rehabilitation facility? So I guess that one is very valid at the moment too. So see if you've got a bit of a score for yourself there. And I'm hoping that at the end of this discussion, we maybe have bumped up a few notches in your self-efficacy score. That would, if we can achieve that today, I'd be pretty impressed.
Kirsty,
Yes.
could I just say something?
Yes.
On the side, the ESES rating scale,
Yeah.
1 and 2 are transposed.
Oh, gosh, thank you.
So 1 should be really true, 2 should be not always true.
Always true. Yes, I've obviously typed that the wrong way around. Thank you for clarifying that.
That just stuffed up my score.
1 star is 2 fours the highest.
Thought I was doing well then.
All right, I'm going to quickly go to the next slide, but keep an eye of what your scores are and we'll see whether or not we've improved at the end. So this is the principle that I use to explain what I'm expecting of people in terms of exercise. So it's called the FIT principle. So the FIT principle for keeping fit, really. It's very easy to remember. But F stands for frequency, so the number of times a week that you exercise. I for intensity, so how hard you exercise. T for time, how long are you exercising for? And T for type, what exercise are you doing? So we're going to go through what the exercise recommendations are, and I'm going to bring them back to that FIT principle. One of the things that often comes up is intensity. And what do these words, moderate and vigorous intensity mean? And do I need a heart rate monitor and everything to exercise at home? So there's a few different ways of monitoring intensity. And no, you don't need to go out and buy a Apple Watch or anything like that. There's a few different ways that I use. So on the left-hand side of the screen is a modified rating of perceived exertion scale. Now, this is a scale that is how hard you perceive that you're working. So hopefully right now, everyone's sitting at a 1 or a 2. We're pretty light exercise right now. We're at rest or minimum activity. But moderate activity, which is what most of the recommendations is sitting up at that 5, where it says speaking is easy and you're lightly sweating. So that kind of then goes along to the talk test, which I've got on the other side, which is the most inexpensive test you can have. Literally, while you're exercising, if you can talk in full conversation without getting breathless at all, you're probably not working hard enough. If you can talk in full sentences, but you're feeling that there's a little bit of breathlessness, then you're achieving that moderate intensity. If you are so breathless that you can't get out sentences and you're gasping for air, then you're really up at that vigorous intensity thing. So yes, we can use heart rate monitors. We can get our training zones and things through that. But it's not necessary. If you're training for sport and you really want to know your training zones, by all means go for it, but it's not necessary. I wouldn't be using that as a barrier to exercise. So we're going to go through, these are the physical activity guidelines here. Now, these guidelines have been created, so the reference is down the bottom there. They've been created by a Canadian group that of researchers, and what they break down is a starting level and an advanced level, which is different to a lot of the other exercise recommendations we do see. But essentially, if we're at a starting level, so you're not exercising, what we're wanting to build up to is 20 minutes of aerobic activity twice a week. And this is a minimum. So this is not the maximum. This is the minimum level that we're wanting to achieve. So 2 times a week, we're wanting 20 minutes of moderate to vigorous intensity. So that's getting you breathless. So that's, you shouldn't be able to maintain a full conversation during your exercise. And you should be doing strength training a minimum of 2 times per week. And with strength training, you want to be working for around 3 sets of 10 and an exercise for each major active muscle group. Now, if you're already exercising, brilliant. And that's why they've also brought in the advanced level, because a lot of people were sort of meeting those minimum guidelines and thinking, oh, excellent, that's me done. So they've now brought in the advanced level, which is 30 minutes of moderate to vigorous intensity exercise 3 times per week. And strength training is still recommended at least 2 times per week. There's 3 sets of 10 for each major active muscle group. So they are based on a scientific review of all the evidence out there and the gold standard practice, and they've been developed by an international group of researchers. So this is the 2020 guidelines that have been released. And we're just going to go into them in a little bit more depth on each one and what they might mean for you. So in terms of cardiovascular exercise, probably the one that most people struggle to get. So at least 2 to 3 times a week of that moderate to high intensity exercise. So we're trying to reach that, level where we're huffing and puffing. We're reaching that 5 on the RPE scale that we looked at before, that colourful picture. And this can be done through, arm bike, swimming, walking, wheelchair propulsion, depending on what your injury level is. It's going to look slightly different for each individual, how you achieve that time frame. If you can't do 20 minutes of cardiovascular exercise at the moment, that's also okay. We can achieve it by breaking it up into small parts. So you could do 5 minutes and have a rest, and do another 5 minutes and have a rest, and slowly get yourself up to being able to do the 20 minutes of exercise. We do know that the health benefits are not as significant from doing smaller amounts. So while that's a good way to get started and build your way up to doing that amount, it is advised that you do try to complete that graded exercise program and get yourself up to meeting these recommendations where possible. At the end of the day, though, some exercise is better than no exercise. So don't use those numbers. If those numbers seem too intimidating to you to start, then that's okay. Let's just bring those numbers down and get started and slowly try to grade your way up. And when you're starting with cardiovascular exercise, you would want to start at a low to moderate intensity. And once you're feeling confident, then start to introduce that high intensity. If you're someone who has been exercising for a long time and you feel very confident that you can do your 30 minutes of moderate intensity, then it's really beneficial to start to introduce some of that next level of that vigorous intensity. That has really good impacts for your cardiovascular and respiratory health as well.
Kirsty, can I just make a comment there? Like, I was inactive for a few months, and when I started getting back into it, you do lose your stamina and your fitness. And when you start going again, like it's hard work. You start puffing really quickly, and you think, shit, this is really bad. But you keep at it, and you get your stamina back. It takes a while, but your stamina does come back. So from 10 minutes, if 10 minutes is too hard, you build up to that. Within a few weeks, you'll be going to 15 and 20 and 30 minutes, So you just got to keep at it and know that just having that consistency is going to build your stamina up.
And I think that's amazing, is everyone understanding that these are general recommendations. And we want to get people up to achieving these. These have been shown to have good health benefits, but everyone here is at a different point. Everyone here has a different health history, a different injury history, and these all need to be considered in your individualized exercise plan. So, yeah, important to take into consideration that these are a general recommendation. We want to get up to them, but if you're not up to them right now, that's okay. We just need a graded and gradual plan to get there. So then our next bit is our strengthening exercise, and at least 2 times per week. And we're looking for that same thing. It's described as a moderate to high intensity, but it's an exercise that you can do 10 repetitions of with good technique. I think that's a very important thing to send home. It's not 10 that you absolutely battle through, but also if you finish your 10 and you think I could probably do another 10, then the resistance really isn't hard enough to actually create any change to your muscles. So that 10 is a number for a reason. We don't just stop at 10 because the number says 10. If you get to 10 and you haven't reached any challenge for your muscles, then you really should be looking to try to increase the resistance somehow. Now, exercise, like I said, it can be different for everyone. Not everyone likes going to the gym. So, you know, it doesn't mean that you have to go to a gym and use weights. You can get small hand weights for home. You can get TheraBands. I'd be surprised if anyone got through rehab without using a TheraBand. So TheraBands are a really cheap, inexpensive way to set up exercise anywhere you want to. You can take them to the park. You can do it at home. So they're a very versatile piece of equipment. There's also, you know, whether it's Pilates or body weight exercise as well. So, you know, even as simple as if you're a manual chair user, so doing some dips in your chair, lifting your body weight up that way. Or if you're a walker, then obviously some squats or standing exercises can also help there. So for everybody, it's going to look slightly different. But for each of your major functioning muscle groups, you should be trying to have a strengthening exercise to focus on each one. Has anyone got any questions before we move on from those basic strengthening guidelines?
I've got one if I can. I was just interested because especially that one you said if you're getting to 10 and there's no, I guess, burn, because I guess with the gym closing, I like going to the gym and I've changed that by doing like some push-ups. I put my knees on like a pillow.
Yeah.
But I guess, you know, after a bit of time, like Noah said, 10's getting quite easy. So do you have some ways I can maybe make it a bit harder?
Yeah, so there's a few different ways that you could progress an exercise. So whether or not you wanted to do push-ups with a resistance band across your shoulders and holding the ends down with each hand, if you wanted to make that an incline push-up, so put your, like if you have your hands below you, say your knees up on the bed, so that you're pushing your weight uphill. There's lots of different ways to progress an exercise when you don't have equipment available to you.
That's good. Thank you.
Yep. Anyone else got any strength-based questions while we're here? No?
I got another one. Right. So could you say strength-based, like say there's a hill, could you push up the hill and that could be sort of a strength thing even though you're pushing your chair, or is that sort of?
Yeah, definitely. I'm fairly sure most people that use a manual chair will say that it takes a good bit of muscle strength to get a chair up a hill.
So yeah, that definitely equals a similar outcome.
Yes, definitely. And so for it gets a bit tricky when you start looking at things like that. So for it to be considered sort of an aerobic exercise, a cardiovascular exercise, it's an effort that you can maintain for a longer period of time that is focusing on training the cardiovascular system. So if you are pushing up quite a steep hill, typically for most, that's not an effort that you could continue for, say, 20 minutes. So that would be a shorter burst where you would be looking more at exercising the anaerobic system, which we won't go too in depth into all the different energy systems, but that would be changing the energy system that was used, and it would also be focusing more on fatiguing the muscles before you actually achieved a cardiovascular training effect.
Mm.
Does that answer your question, Josh?
Yeah, that's good.
Yeah. Okay. Sorry, once you start going down those levels, we could go all day. So cardiometabolic health. So I just wanted to have, now that we've gone through the recommendations, a bit of a particular look at each part of the health that we might consider in spinal cord injury. In terms of cardiometabolic health, it's a very big one for spinal cord injury because it's been found to be the leading cause of early mortality in spinal cord injury. So in terms of long-term health and, you know, good quality of life and longevity, this is a really important thing. And one thing I like to point out is it's not too late to start exercising. So while, yes, someone who started exercising early in life and kept that going, you know, forever, they, you know, have a much higher health, sort of a much lower risk of health conditions. But the late exercises still do catch up. So if you're looking at that graph and you've got the pink line of someone who never starts exercise and they stay down at the bottom the whole time. If you've got the late exercises, their heart disease mortality ratio, that comes up close to the lifetime exercises. So if you haven't started exercising, you can still make a very big impact on your risk of heart disease by starting exercise now. The recommendations for having an effect on cardiometabolic health is slightly higher than the general recommendations. So they do recommend at least 25 minutes of daily moderate intensity. So it is higher than what the general recommendations are. But if you're looking just at cardiometabolic risk factors and minimizing your risk of heart conditions, then the recommendations are for 25 minutes per day of moderate intensity exercise. One of the discussions that I haven't actually popped in here, but I might just talk about now, is the difference between physical activity and exercise. So the two terms do tend to get thrown around quite a bit, and physical activity guidelines get thrown around, but I think it's easy to get a bit confused between the two different terms. So technically, if you're going to get bogged down into it, is that exercise is planned, structured exercise that is aimed to have a physiological effect on your body. So we're doing exercise to improve or to impact on our heart and lung and muscles. Where physical activity includes a lot more. So it includes incidental physical activity, where you might just be propelling your chair around the house, or you're moving around, or you're cleaning, or you're gardening, and you're still moving your body, but we're not moving it to the level where we're inducing a training effect on the body. So that's where those two differ. And so what we do see lots of benefits from physical activity. We see especially mental health benefits, and we do see some health benefits. But in terms of seeing these quite significant changes in health risk factors, we really are talking about exercise. Does that clarify that at all for anyone? Yeah.
That's
I
good.
think that's a good explanation, Kirsty, because so pretty much your movement has to, you have to, in a way, not torture your body, but
I haven't
push
said
it.
that
No, you have to push it to its limit. So if you're doing housework, I guess you're just doing enough, you're using enough energy to get the job done, whereas exercise, you're pushing the limits, you're actually straining your body.
So yeah, we're achieving what we saw on that RPE scale earlier, that colourful picture earlier. We're achieving that moderate intensity where we are lightly huffing or puffing, or where we are feeling our muscles are working. If it's a task that you can complete fairly effortlessly without thinking about it, then that's probably lumped more in the physical activity box than the exercise box. Yeah. So I guess the other thing I wanted to talk about the exercise guidelines are great for overall health, but exercise is going to look different for everyone, depending on what they're there for. So for every client I see, they're there for different goals. Some are there for lifestyle management and, that sort of setting up of a long-term exercise program. Some are there for early rehab, and some are there for sort of dealing with injuries and things that have come up along the years. So in terms of shoulder health and spinal cord injury, another really important area, and to think about as early as possible, is that 30 to 70% of persons with spinal cord injury report experiencing some shoulder pain. And for anyone who uses either a manual chair or transfers a lot, or even uses gait aids like walking frames, I'm sure that they've all experienced some element of shoulder pain over the years. Both the reported incidence of a high incidence and severity of shoulder pain with time post-injury. So the longer post-injury, the risk of that shoulder pain being, one, happening more often, and two, being a higher level of pain. One of the things to think about is that the shoulder joint itself, and so I've just thrown that little picture up there for everyone, it's not designed to be a weight-bearing joint. So the joint itself is quite open. There's a lot of ligaments and tendons that do run through that joint space, and it was never designed to be a weight-bearing joint. Unfortunately, once we've had an injury such as a spinal cord injury and you're having to propel a manual wheelchair and do highly repetitive tasks such as transfers, that shoulder becomes a weight-bearing joint. So the wear and tear on the shoulder is quite a lot. And the risk of chronic impingement syndromes and rotator cuff tears are the most common causes of shoulder pain. So without intervention, shoulder pain after spinal cord injury is associated with loss of function, a decrease in community mobility, and in correlation with that, a decrease in quality of life. One of the best things that can be done is early and preventative exercise. Once we do have an injury, obviously, then it's treating it with therapeutic exercise as well. So chronic shoulder pain after spinal cord injury can be markedly reduced by using a strengthening and stretching exercise program combined with assessment and modification of your performance technique of several upper extremity weight-bearing activities. So that might be the technique you use when pushing your chair, the technique you use when transferring, setting up the environment around you so that you don't have high risk factors. So some of the really high risk things for shoulders are repetitively reaching up above your head. So modifying your environment so the things that you need really often are down low, and only the things that you need to get every now and then are up high, so that we minimize that risk of impingement. But that TheraBand that I'm sure everyone's got experience with is one of the most useful things you can get in terms of strengthening that rotator cuff and those muscles that support the shoulder joint.
So some of those TheraBand exercises are just like internal, external. I'm not sure
Yeah,
you call that one with the butterflies.
Can't actually see me. Your internal and external rotation are two of the main exercises, as well as some of your adduction and stretching to the pecs, to the shoulder muscles as well.
Because I think with, if I can use my own case, I think my left shoulder, that's not my dominant one. And I feel the range is a bit less than my right. And I've got no trunk, and I guess obviously pushing the chair, leaning forward a bit more often.
Yeah.
So I guess the stretching and then being a bit more repetitive with the TheraBand will be beneficial on that.
Well, that's the thing. And with all muscles, it's a balance between strength and length. So stretching is just important, and keeping that integrity of the joint and keeping the range of motion as well.
Yeah. That's the hardest one, I guess, because when you have to go push the chair after you fatigue, you lose all that integrity.
Yeah, and that's what we were sort of talking about on that slide of the repetitiveness of those weight-bearing activities that a spinal cord injured shoulder has to do, is that, propelling the chair all day and transferring so many times a day, it really does the shoulders do take the brunt.
Yeah. Is it quite common to get distal, like that build-up of on top of is it the AC or whatever it is?
Yeah, it is. Like, shoulder injuries, post-spinal cord injury are way too common. So definitely common, but definitely manageable with corrective exercise.
Yeah.
Yeah.
You listening to that, Naz?
Yes, I am. And I had a question as well, Kirsty. I'm not sure this is not your area, but you might have some advice. So when people do have like serious rotator cuff injuries, of course, it doesn't heal itself. Do you know if people have surgery, and I think that's probably the only or one of the only options, is that something people can pursue, or is it successful?
I would, if someone's got a severe rotator cuff tear, then definitely it's worth getting an opinion from a surgeon. They're not often. I haven't come across many that have actually gone under the knife and gone for surgery. It is more common that it's conservatively managed through whether it be cortisone injections to manage the inflammation and then exercise. People do live with what we call asymptomatic rotator cuff tears, so ones that are pain-free. It's the pain that's the issue. There's lots of people who do live quite well with asymptomatic tears. But yeah, that's definitely an individual process to go through of whether or not surgery. There's pretty big implications of having a shoulder surgery for someone with a spinal cord injury in terms of the rehab after it, and things like not being able to transfer or push a manual wheelchair for that period of time as well. So yeah, that's definitely individualized process, which I'd be consulting with a pretty in-depth healthcare team.
Okay, thanks.
Yeah.
Is that assessed by ultrasound, or is it generally assessed by pain and I guess your own observation by eye?
I like in the clinic, physical therapists would assess it with just range of motion testing and some other testing. If there was pain on movement, then we would refer for an ultrasound.
Interesting.
Or other investigations by the doctors. Yeah, a bit hard to see what's going on from the outside.
Yeah, exactly.
Good. So the next I guess area I wanted to talk about was the impact of weight management in spinal cord injury. Another one that kind of correlates to the cardio-metabolic slide we were talking to earlier. So obviously with weight gain, we're at increased medical risk of cardiovascular disease, type 2 diabetes, sleep apnea, and pressure areas. Associated with weight gain is also increased psychological distress and reported decreased quality of life. It also has functional implications in terms of decreased functional independence and increased carer needs. So if people do require care assistance for dressing, hoisting, then if their weight does go over a certain limit, that does change from a one-person assist to a two-person assist. And there's also equipment considerations. So we all know how expensive wheelchairs and everything are. So if you grow out of your wheelchair, that's quite an expensive thing to replace. And other things that bariatric equipment. So if you do end up requiring bariatric equipment, don't always fit through doorways and don't always fit on lifts in taxis and things like that. So there's quite significant implications for community access as well. So weight management in spinal cord injury is a bit of a hard conversation to have, really. We look at the scales on the left, and I'm sure that you probably all went through this briefly. I know that you had the dietitian speak with you recently. When we're looking at weight management, we're essentially looking at energy balance. So on the left-hand side of the scale, we've got calories consumed by eating. And then on the right-hand side, we've got the calories expended. And that's broken up into three different things. So you've got your resting calories, which is what we call your resting energy expenditure or resting metabolic rate. And that is the energy that it just takes to stay alive. So breathing, digesting things, everything, that burns energy too. So there's a certain amount of energy, even if you laid still, that you would still be burning just to maintain your bodily functions to stay alive. Then in the green, we've got activity. And that's what we talked about before, of that physical activity or incidental activity. So the bits and pieces that you burn just going about your day. And then in blue, we've got your planned structured exercise. So those three things add up over the day to make your total energy expenditure. And if we are aiming to maintain your weight, then we need those two numbers to look similar. We need your calories that you're eating and your calories that you're expending to be fairly similar. If you're aiming to gain weight, then we need you to eat more. And if you're aiming to lose weight, then we need your number that you're intaking to be less than what you're outputting. It's not exactly rocket science. It's pretty straightforward. But I guess where it comes into it with spinal cord injury is research has shown, and I have put a couple of references down the bottom of the slide if anyone has any inclination to go and read some journal articles. Research has shown that people after a spinal cord injury do have, I think it's about, oh, it's on the slide, there you go, 22% less than able-bodied. So your resting energy expenditure, even at rest, is 22% lower than a person without a spinal cord injury. So if we now take that yellow bit of the graph and we take 22% out of that, that's now that energy expenditure. And then when you are physically active, that number is still lower. And if you're using a chair, your opportunity for incidental exercise is considerably lower again. So we're not able to achieve as much activity through incidental movement. So, you know, whether you used to work in a really active job and now that you're in a chair, you're not moving around quite as much as you used to. So that number becomes less. And then again, when we exercise, the energy expended is lower due to the smaller muscle mass that's active during exercise. So if we put those three factors together, the overall energy expenditure over the day is considerably lower than an able-bodied person. So essentially, we can't afford to eat as much. So the calorie expenditure isn't as high. The calorie intake can't be as high. Otherwise, there's going to be an instant shift to weight gain. So really, the take-home message for weight management really is that diet and nutrition is the key. Exercise, as I'm hoping everyone's starting to realise, has got a myriad of health benefits. It is really important for all those other things that we've talked about today. And it does help, like it obviously the energy expenditure, it's better to have some energy expenditure through exercise. It's just not sufficient enough to be burning all the energy that you might be consuming. So if weight loss is your goal, I would definitely be encouraging you to talk with a dietitian. Diet and nutrition really is the key for weight management, with exercise to support it, and with exercise to support all your other health goals.
Just a side question, and sorry to delve into the spasm side of things again, but you know, I guess when I sleep, I have like every 2 seconds like a little pulsation of spasm. Is there any incidental energy use in spasm? Has there been any research on that? Just out of interest.
I know that spasm is a muscular contraction which takes energy. As to how that equates into what type, how much energy, I can't give you an answer on that. Sorry.
That's okay. I was just
On spasm, I used to have really bad spasms, and I started doing the splits, and it's really reduced my spasm a lot. Also, getting my knee bent, one leg straight and my knee bent, and pushing down on my knee, and then doing the other knee. And I've reduced my backward from 200 down to 75 just by stretching my legs and doing those exercises. So if you do the splits, it takes time. I'm not very good at it, but it's made a huge difference to the amount of spasm I've got. It really has. And
Caution if your hips don't have that flexibility.
Yeah.
well, it just takes time. You can't like do the splits, they're not parallel, but they are, on a, I don't know, but they've even at a 60-degree angle. And I've been doing it for a couple of months now, and it's really made a huge difference. So if you want to reduce your spasm, then you need to exercise your legs and look into.
Oh, yeah, I guess, like back to what Chrissy's been saying, it's very individual, I guess, but I actually like my spasm. I actually use it a lot to help me turn over in bed or, for my different transfers. So I actually find it an advantage for myself. But yeah, I think Chrissy, like you're saying, it's all very individual.
Alrighty. I'm going to quickly, we are getting there. We're almost towards the end. I know I've been talking your ear off for almost an hour now. So other considerations, really, I just wanted to pull it back in that it's important to consider individual goals. Exercise will look different to everyone, whether that be because of your personal preferences, your different goals, your different health backgrounds and injuries. It's going to look different to everyone. I'm sure if, you all went to set up a new exercise program, they would all be different. And it will also look different for each person through different stages of your life. So your rehabilitation program will look very, very different to what your general health and lifestyle management program is. And then sports and recreation participation and everything like that as well. So there is no one size fits all. It really is an individualized process depending on all those health factors and personal preferences. And it's really important to not compare yourself, I guess, to what other people might be doing and to just consider your own health. So things that you should consider before starting a new exercise program is your recent health, impact of your spinal cord injury on the body, so thermoregulation, bowel and bladder function, hand function, pressure management, and how does that relate to you participating in exercise? Any pre-existing injuries or pain, and then your exercise history, so your current level of fitness and your suitable equipment available, or what your preferences might be as the environment that you exercise in. In terms of what an exercise physiologist would consider when prescribing an exercise program is a bit of a combination of a lot of what we've spoken about today. So we've got your health-related components, so your risk factor, either your health history or your risk factors of certain health conditions, and minimizing those risk factors as much as possible. Medical-related components, so what medications are you taking? What is your recent medical history? And then also your skill or functional related components. So is there a skill that you're wanting to learn? Are we functionally retraining something in particular? So we're sort of looking through those different domains to pull together an overall exercise program that helps with all of those. So in terms of tips for getting started, if you're not already exercising, I'd say if you have not been active recently, I would recommend chatting to your doctor or a health professional, a physio or an exercise physiologist. Start gently and gradually increase the amount of exercise you do. Some tools for sticking to a program, which I think seems to be the hardest part for most people, is using a weekly exercise planner, getting a workout buddy, choosing exercise that you enjoy doing, and regularly setting goals or using an activity or a goals tracker to make sure that you're working towards something. So that is my overview of exercise and spinal cord injury. I know that there's quite a bit to take in, and I tried to keep it fairly broad for you. Has anyone got any questions before I finish up?
If you want to find a physio, you just look in the yellow pages or online, do you? If
you're trying to find an exercise physiologist, you could look, there's a website called ESSA. If I go right back to the start, there was, so just there, ESSA is the accreditation body for exercise physiologists. So that's who we get all our professional registration from. And if you go onto the ESSA website, you can go to the Find an EP. And you can pop in your postcode and it will tell you an exercise physiologist that work in your area.
All right, no worries.
Anyone else got any questions at all?
That was good, thank you.
Yeah.
Yes, thanks very much, Kirsty.
My pleasure. Nice to see some familiar faces. I am going
Yes.
to, I think, oh, yep, Naz has
Kirsty.
headed up. I think I'm going to,
So Naz has left,
Oh,
Kirsty. I
no.
was just wondering, before you go, did you want to speak to, I guess, where you are now? Is that STEPS, correct?
yeah, so now
Yeah.
I'm working at STEPS therapy. I think I briefly went over that at the start of
Oh,
the,
did you? Sorry, I missed that.
yeah, so I work at STEPS therapy now in Hughesdale,
Yeah.
and we sort of do a lot of centre-based therapy, but also do home visits and, you know, when we can, set up programs in community gyms and everything as well. That's what I was saying at the start. It's been a really fortunate career progression for me, Josh, is that I've had the chance of working both in early rehab and sort of across the lifespan of spinal cord injury in the community.
Yeah.
Yeah.
Well, thank you very much. You sure there's no more questions, team? We've got to...
No, I'm all good, thank you.
Very
Just
good.
need to find an exercise physiologist.
If you can't find one, then let us know and I'll shoot you a few contacts.
Okay.